Okay, we're going to be discussing F880, which is infection control. During our last survey, upon the surveyor's exit, they had two concerns upon their departure. They had a concern with staff not performing hand hygiene properly with resident care and not ensuring that catheter drainage bag was properly stored. So we're going to go over, because this opens up our F880 tag for everything, we're going to focus on all aspects of infection control, but we are going to focus on hand hygiene and catheter care. So hand hygiene, as we know, is the single most effective way you can stop healthcare acquired infections and stopping the spread of germs. Some common times of when you should be washing your hands is before touching a patient, before cleaning or doing a procedure, after bodily fluid exposure, after touching a patient, or after touching the patient's surroundings. Hand hygiene can be completed with soap and water or alcohol-based hand sanitizer. Just a reminder, if you are using alcohol-based hand sanitizer that is not provided by the facility, we have to ensure that the alcohol content of it is at least 65%. When washing your hands with soap and water, you need to make sure that you're always washing your hands with soap and water. Anytime your hands are visibly soiled, if you're exiting or entering a contact precautions room, and before and after using the bathroom. For catheter care, we always want to make sure that the catheter bags are emptied at least once a shift, or if you're noting them to be full throughout your shift, you need to empty them again. Residents with indwelling catheters should have the catheter bag changed prior to collecting a urine specimen, and we should only be irrigating a urine catheter with a specific order from a physician. Catheter changes should only occur when the system is compromised or malfunctioned. So if the urine is not draining properly or if it's leaking, that is when we should be changing the catheter. So catheter care procedure. So residents who have a catheter, we should be making sure that we're cleaning them at least every 8 hours. You'll want to make sure that you're using a clean washcloth and cleaning it in a circular motion the first 4 inches of the catheter, and avoid making sure that you're not placing any tension on the catheter. We also don't want to use any powders or lotions in the perineum area because that is contraindicated because it is a risk for growth of microorganisms. Catheter bags are to have a barrier as well, such as a dignity bag. So if you're noting that a resident doesn't have a dignity bag, please find one or ask someone to assist you with finding one. And those bags should also be cleaned each morning. I don't think that we have anybody currently using a leg bag, but anytime that we're changing from a drainage bag to a leg bag, we should be wiping those bags down. And all catheter bags are changed monthly and should be dated. So this is the process for emptying a catheter bag. You always want to make sure you wash your hands with soap and water and apply gloves. You're going to get a barrier and a container to drain your urine in. Make sure that you're holding the drainage tube over the toilet or the container. Open the valve. Make sure you don't touch the valve on anything, as that would contaminate it. You're going to empty your bag, and then prior to putting the valve back into its slot, you're going to wipe it with an alcohol wipe. You're going to measure your urine, empty it from the container, rinse the container and let it dry, and then store the container in a plastic bag in the bedside cabinet or in a plastic bag in the bathroom. And then remove your gloves and again, wash your hands with soap and water. Anytime we are placing the catheter bag for storage, we do not want to put it on a trash can or placing it on the floor. Even though the catheter bag contains urine, it is considered a clean object, where the trash can and the floor are considered dirty, so placing that clean catheter bag on the floor is potential contamination. Okay, so what is COVID-19? We are all very familiar with COVID-19, but it is a respiratory illness that can spread from person to person through respiratory droplets. And the virus can also spread by touching a surface or object that has the virus on it when touching your nose, mouth, or eyes. Symptoms of COVID-19. There's fever, chills, cough, shortness of breath, fatigue, new loss of taste or smell, muscle or body aches, headache, sore throat, congestion or runny nose, nausea or vomiting, and diarrhea. So who is at risk for contracting COVID-19? Our entire population that we serve is at high risk just because they're older adults, and most of them are comorbidities. So they have multiple medical conditions that increase their risk for that COVID-19. Their immune systems grow weaker with the age and their chronic medical conditions. So we as a staff have to make sure that we are doing everything in our power to prevent them from contracting COVID-19. So back to hand hygiene. Soap and water. So when you're washing your hands with soap and water, you want to make sure that you're rubbing your hands together for at least 20 seconds, covering all surfaces, the back of your hands, between your fingers, underneath your fingernails, and your wrist. Rinse your hands, grab a clean paper towel, dry your hands off, and then after you dry your hands up, that's when you grab another clean paper towel and turn the faucet off. For alcohol-based hand sanitizers, like I said, you can use all hand sanitizers as long as they're 65% alcohol-based. You'll want to make sure that you're rubbing your hands together in all surface areas, again, between your fingers, both hands, back, and the wrists. And then you're going to make sure that you're rubbing your hands again until your surface areas are dry. Don't wipe off the excess gel because then that's ineffective hand hygiene. Okay, so what do we as a facility do to prevent COVID-19? So we previously had COVID visitor restrictions, but those recently have been lifted. We audit our residents every shift for any symptoms. We audit our staff, screen them with temperatures and questionnaires upon their arrival for their shift. We have activity restrictions, social distancing, restricting resident travel outside the facility, but that has also changed in the last few months. Now they are able to come and go as they please. We educate resident staff in the community, and we also encourage the vaccine. Staff screening, we are all very aware of this. Make sure that you are screening in before your shift. If you accidentally answer the questions wrong on the kiosk, that's okay. We just ask that you redo your screener so that we have the correct data in the system. So what do you do if you get sick at work? So if you are sick prior to coming to work, please do not report to work. Call your supervisor, let them know what symptoms you're having, and they will direct you from there. But if you came to work with no symptoms, but you get ill during your shift, please do not go through the facility trying to locate your supervisor. Contact them, let them know you're having symptoms, and then they will ask you to leave. Because we are doing testing, we will probably have you do a rapid testing, and if that was negative, we would follow up with a PCR test that is transferred out to our lab to be completed for results. You will be off work until those results are back, but we will contact you as soon as we have those. Resident screening is very similar to staff screening. We screen them every shift for symptoms, and then we do the same process for their testing. If they're symptomatic, we do a rapid test. If that is negative, then we proceed with doing a PCR. They remain in isolation as soon as they have symptoms until that PCR result is back. We do close monitoring with our screening. So transmission-based precautions, we have contact precautions, droplet precautions, airborne precautions, and then COVID-19 transmission-based precautions is basically all of those three combined into one. So we refer to them as COVID-19 transmission-based precautions. So vaccination, as you are all very well aware, our vaccination status for staff is you have to at least have your one step by December 5th and then your second step by January 4th. So all of our staff by January 4th will be fully vaccinated. And our residents are strongly encouraged, with only about 8 of them that are not currently vaccinated. So you'll want to make sure that you're wearing your PPE at all times, and making sure that you're reading the signage to what you're supposed to be wearing. We're going to go over how to put on your PPE and what to wear with each putting on and taking off in each precaution at the end when we review the post-test. So part of our PPE, we have gloves, gowns, mask, goggles, and face shield. And it's very important that you're wearing your goggles appropriately. So over your mask appropriately. So over your nose and over your mouth, not putting it underneath your nose so that you can breathe. That's the whole point of having the mask, is so that your expiration is not going to others. So please make sure you're wearing your mask appropriately, as well as your goggles. And again, we will go over donning and doffing of PPE at the end. Okay, so back to goggles. So we are currently required to wear goggles, not because of the facility, but because of our current county level positivity rate. So all goggles or a face shield have to be worn at all times. If you're in the break room or you're in a meeting area, it's okay to take those off. But as soon as you step onto the unit, into the hallways, in a resident's room, you have to have those on for the entire time. Even at the nurse's station, that's required. That's considered a resident patient area, so you have to have them on. As soon as the county positivity rate drops, hopefully we'll be able to remove those from our current PPE process. And again, preserving PPE. So we want to make sure that when we're wearing our masks, that we're only wearing them for 5 days or 5 shifts. So if you work Monday through Friday, you'll have a new mask every Monday. If you're working 3/12s, after 5 shifts, please make sure you are replacing your mask. If you need a new one, you can get one at the receptionist desk or from your unit manager. Cleaning and disinfecting products. Contact time is the amount of time required for a surface to remain wet when germicidal activity to take place. So if you are unfamiliar with where to find your contact time, you'll want to refer to the back of the product label, and it should tell you 1 minute, 2 minute, 5 minute, but most of ours are 2 minutes, and they're the purple top containers. So we'll use those on our glucometers. So anything that you're using from resident to resident, glucometers, lifts, shared equipment such as stethoscopes, please make sure that you're using those. And you'll always want to clean from cleanest to dirtiest, and always making sure that that area is wet long enough for that contact time to be effective. Dementia care and COVID-19. So with our residents who do have dementia, most of the residents we serve have some type of cognitive or dementia diagnosis. So sometimes us wearing our PPE is very scary to them. So we want to make sure that we're meeting their basic needs, that we're specific in identifying what has worked for each of those residents in the past and care planning it, and then reducing any excess stimulation and trying to create as calm and soothing environment as possible. Testing is not a fun time for these residents. It's very scary to them. We're sticking a swab up in their nose that is uncomfortable, and they don't understand why this has to happen. So we want to make sure that we're approaching them. Sometimes if they have a good rapport with a certain staff member, having that person going to them. Be mindful of the residents' body language, and minimize any distractions and avoid conflict by reapproaching them at a later time. Always approach in that calm, caring manner, and never force the resident to be tested. We can always reapproach, we can have somebody else approach them, but we should not be forcing them to be tested. Room changes. Tips for moving a resident with a dementia diagnosis to a positive COVID-19. This is a new space for them, so we want to make sure it's as welcoming as possible. So we can bring some familiar objects and pictures from their room. We don't want to move their entire room just because we want to get them moved as timely as possible, but some things that are very familiar for them or that they're constantly wanting in their site, we want to bring with them. We want to educate the staff who are working the COVID-19 unit about this resident and make sure that they're comfortable, that they can support them, and try to maintain the resident's routine and schedule as much as possible. Okay, now we're going to go over the post-test. So number 1, hand hygiene is the most effective way to prevent the spread of COVID-19 and other infections. True. How would you obtain the correct contact time for a disinfectant? C, read the product label. Contact time is the amount of time required for a surface to remain wet for germicidal activity to take place. True. What type of wipe should be used to clean shared equipment if a resident is positive for COVID-19? A, hospital-approved disinfectant. Identify the proper order in which PPE should be applied. The order is hand hygiene 1, gown 2, mask N95 3, goggles, face shield 4, hand hygiene 5, gloves 6. Who must adhere to the isolation precaution signage instructions? B, all healthcare personnel. Identify the proper order in which PPE should be removed with severe respiratory precautions. The order is gloves 1, hand hygiene 2, face shield goggles 3, hand hygiene 4, gown 5, hand hygiene 6, face mask 7, and hand hygiene 8. Hand hygiene must occur when? All of the above. Who do you call to replenish the supply of gowns in a medication room? Materials management. When washing hands with soap and water, how long do you wash your hands for? C, 20 seconds. When washing hands with hand sanitizer, how long do you rub your hands together for? Until dry. Who do you call to replenish the supply of gloves in the supply room? C, materials management. What are some symptoms of COVID-19? Select all that apply. And that is all of them. What are examples of standard precautions? Select all that apply. A, B, C, and E. If a resident is admitted to 14-day COVID-19 observation room, what precautions will be needed? B, COVID-19 transmission-based precautions. An employee can wear a standard isolation mask in a room with COVID-19 transmission-based precautions, severe respiratory precautions. False. Prescription eyeglasses are a proper form of eye protection. False. If gloves are worn during cares, hands do not have to be washed after removal of gloves. False. It is not acceptable to wipe your hands on your scrubs after using alcohol-based hand sanitizer. True. Residents who test positive for COVID-19 but have no symptoms should be moved to the COVID-19 positive unit. True. To help prevent the spread of COVID-19 in the facility, select all that apply. And the answer is all of them. What considerations or tasks should be addressed when caring for positive COVID-19 dementia residents? Select all that apply. A, B, D. What PPE should staff don prior to entering a room with severe respiratory precautions? Select all that apply. A, B, C, and E. What should you do if you become ill while at work? B, notify your supervisor and leave the facility. How should you respond to a dementia resident who is behavioral? Select all that apply. A, B, D, and E. Residents on the COVID-19 positive or 14-day COVID-19 quarantine rooms are allowed to eat in the dining room. False. Residents are encouraged to wear a face mask if they are out of their room. True. Reminding someone to wear their face mask properly, covering their nose and mouth, should be done as soon as improper wearing is noted. True. It is acceptable to place a resident's catheter bag on the floor or hang it on a trash can. False. A resident's catheter bag should be changed how often? C. Monthly. And the last question, catheter bags should be emptied A. At least once per shift, and B. When noted to be full.